The biggest change to home health care really happened during the Obama era, where the Center for Medicaid and Medicaid Services that really pays for most of the home health expenditure. So home health is really financed mostly by Medicare. They decided that they need to do something. They saw this huge growth in spend from 50, 60 billion 5 years ago to 100 billion. And they realized that, the market is growing, but are we actually getting value for the Medicare funds that are spent on home health? And what they did is two main things. One is they started to put in quality measures in place, ratings. And they started with the hospitals, really, and forcing the hospitals to try and keep people out of hospitals for 30 days. If the patient comes back within 30 days, we are actually going to penalize you because, you were supposed to make them better. The second change was rates were starting to be cut and will continue to go down in the foreseeable future. So Medicare said to providers, listen guys, we are going to pay you less and less. Why? Because we want you to become more efficient. We know that the industry is growing, so we need to get more for every dollar that we're spending. But what's absolutely right now looks to be the case is that Medicare, at least, is not going to be touched. Why? Well, think about it. How old is Donald Trump, right? If you looked at the voters' demographics in the US, it wasn't the young millennials that brought him to where he is. And so even though Medicare is a very expensive program for the federal government, I don't think it will be touched by Donald Trump, because if he does reduce any coverage in Medicare, that's a big risk for his ability to get reelected. And so I think that at least in that manner, I think the efficiency steps will continue. Outcomes, hopefully the focus on outcome will remain, and the pay for keeping people out of hospitals. Readmission is still a huge cost to the system, but Medicare is probably not going to be touched.